we go. Dr. Compton, welcome. Okay, we have a quorum. So good morning and welcome to the February meeting of the Louisville Metro Board of Health. This meeting is virtual only and is being streamed live on Facebook. A huge shout out to the Public Health Communications team and especially Catalina Cordova for their ongoing technical savvy and assistance. The impact of climate change on health could not be a more timely subject for our prospective session today or for me personally. As I have done for several years, the next few months, I'm living in a community and in a 42-year-old building that took a direct and traumatic hit from Hurricane Ian. My building's full recovery will take 2+ years. There are large swaths of Southwest Florida that were completely decimated. The devastating impact and recovery necessary for communities affected by historic environmental disasters is outsized, especially for those most vulnerable. These communities have now learned the hard way that preparedness, infrastructure, systems redundancy, and prioritization of scientific research findings are tantamount to equitable survival, especially for the most vulnerable. The lessons this personal experience have taught me have transformed my own decisions, my own priorities, and preparedness standards, both in Louisville and in Southwest Florida. COVID taught us about the need for environmental surveillance as an indicator or early warning of oncoming wobblers. Neither COVID nor Florida hurricanes are once-in-a-lifetime experiences. History has now clearly taught us that there is no once-in-a-lifetime occurrence. We cannot again be caught ill-equipped or flat-footed. In Louisville and across the state, we experience wind events, are susceptible to earthquakes, flooding, etc. How often during these occurrences do we experience loss of electricity, especially for under-resourced portions of the community, near parks or rivers, or continued flooding in low-lying areas without proper drainage, sewers, water pipes? Dr. Ted Smith, U of L School of Medicine's Professor of Environmental Health and Director of the Christina Lee Brown Envirome Institute, joins us today to lead an engaging perspective session. His and the Institute's leading edge work in wastewater surveillance allowed us to recover faster from COVID and other variants than other communities across the country. And on a tangential side, as we experience the consequences of the outbreaks, of the COVID outbreaks, and their clinical and behavioral health impact, this past Sunday, Axios, a Capitol Hill digital news publication, or RAG as I call it, ran a piece on a recent Pew Research report that revealed that 40% of parents said they are extremely worried that their children will struggle with anxiety or depression. You can Google pewresearchreports.org, Parenting in America Today, for this article. And as a sidebar, I have spoken with Dr. Eva Stone about JCPS, et cetera, and also with Deputy Mayor George. And we are going to have a meeting together to pursue this going forward. First, though, we have one item of governance to cover. Minutes of the January board meeting were included in your pre-read material. At this point, are there any comments or edits? And if none, the chair will entertain a motion to approve the January minutes as distributed. Comments?
So move.
Is there a second?
Second.
Any objections? All right, then the January meetings stand approved as distributed. As mentioned, today's perspective session speaker and discussion features Dr. Ted Smith. For a bit of background, the National Institute of Environmental Health Sciences has increased its focus on the health burden of the effects of climate change. Dr. Smith will provide an overview of the work of the Envirome Institute in the area of health vulnerability in Jefferson County and its connections to risks of extreme weather and related hardships. Importantly, he will focus on how this work connects to the ongoing work in health equity and the social determinants of health. Dr. Smith will share information about the role Louisville could play in convening the scientific and cultural conversation in partnership with NIEHS and the Aspen Institute. Dr. Smith, or Ted, is a research associate professor in the Division of Environmental Medicine and director of the Center for Healthy Air, Water, and Soil at the Christina Lee Brown Envirome Institute. His research focuses on environmental technologies that provide place-based clinical insight for preventing or reducing the burden of disease. He was previously the Chief of Civic Innovation for the City of Louisville and created the largest real-time asthma monitoring project, Air Louisville. Dr. Smith leads the wastewater monitoring on behalf of the Louisville Metro Health Department. The project has been sampling SARS-CoV from neighborhood sites across Louisville since June of 2020. Ted also leads the Commonwealth of Kentucky's wastewater monitoring of correctional facilities for the State Health Department. He received his BS in biology and psychology from Allegheny College, his MS and PhD in experimental psychology from Miami University, and postdoctoral studies at MIT. May I present Dr. Ted Smith, whose comments will address health vulnerability and climate change. After his presentation, as we do, there will be an open Q&A session. Dr. Smith.
All right, well, good morning, and thank you, Heidi. You always give me a promotion. I am not the director of the Christina Lee Brown Envirome Institute. That is Dr. Arnie Butnagar, my boss, who many of you know. But I do direct the Center for Healthy Air, Water, and Soil, and I've done all those other things you said, so we're mostly right.
I promote people.
Yeah, I'll take it. If you could just let the dean know, that would be helpful.
Yes, we'll do that.
So thank you for the wonderful introduction. Thank you all for spending a few minutes on this whirlwind tour. The background, as Heidi mentioned, it really is a sort of a function of the strength that we have here at the University of Louisville in environmental health sciences. And so the Envirome Institute as one example of that, and there are many different parts of U of L that touch environmental health. We are fully dedicated and committed to understanding how our physiology interacts with our environmental circumstances. Big focuses on cardiometabolic disease, but we certainly have ventured into lots of other things, including infectious diseases during the pandemic. So we weren't surprised when the National Institutes of Environmental Health Sciences reached out with the significant emphasis in the Biden administration on climate issues. All of the national institutes have been charged with contemplating what role they play in informing the national dialogue and the research agenda and the implementation agenda for the country. And so, that call many months ago has really resulted in what I think is the best of our city. And, I'm a big believer in town-gown relationships. I worked for the city for a period of time, and now I work for the university. And I think they are the remarkable sort of pillar institutions to really keep us on track. And so the question really was, could you help us work on the health, the deeper, not the superficial aspects of health, but the deeper issues of health and climate? And this was coinciding with some conversations that we've been having over the last year with the American Red Cross, which they initiated and sort of their world is disaster preparedness. And of course, in Kentucky, we know that we've had a string of pretty significant extreme weather events, and there's a real concern that we perhaps can't just immediately be able to respond to multiple threats at the same time. I mean, we were fortunate to have, some spacing between what happened in Western Kentucky and what happened in Eastern Kentucky. Had they happened at the same time, it would have been a very difficult situation to cope with. Now, many believe that we have much more of this ahead of us, and that we shouldn't just say, well, that was lucky that we didn't have, multiple events at the same time. There's every reason to believe that we will be dealing with extreme weather events and other natural disasters that we may not have contemplated when we built our cities and when we settled this area. So our going in position, and the majority of what I'm going to share with you today, is our orientation around this issue. So as you know, the climate agenda is very broad. It's historically been defined largely around energy transition issues and things that really have little to do immediately with health. But as we look at the impact of events on people, we have to apply a different lens. The lens that we're advocating is one of vulnerability. And so, we know that there are many parts of the globe that are concerned just really based on their circumstances, close to a body of water, in an environment where, drought can be a significant economic disabler for a country, and those are all easy to understand at some level, concerns. Our angle and our interest is looking at the health and well-being of the people as an important axis of understanding where this risk is greatest. And this is always how we think about environmental health, right? So we think about health as a product of emergent from our circumstances. So we know that in Kentucky and in Jefferson County, we have a very high burden of chronic disease, and we have great disparities in the health of our population. And so vulnerability, when factored into the conversation about changing circumstances, is a direct path in some sense to what the health consequences will be. And so I'd like to walk you through, this is unpublished preliminary work, so I won't be offended if you have any constructive criticism, but I also want you to know that this isn't the final reveal. This is a sort of work in progress. So
Dr. Smith, let me just
sir.
tell folks that the deck will be distributed. You will get a copy of that. So
yes,
get that.
and I'm sorry you didn't have that in advance, but you will absolutely.
No, that's not a problem at all. Please
Okay.
continue.
Absolutely. So I'm sure many at this meeting know that there's been a long-standing commitment to understanding vulnerability across the CDC and the EPA and different parts of HHS. So there's nothing new here in the sense that we know that vulnerability is an important factor. All the work in COVID across the state has been informed in part by background information about the vulnerability of different populations and all the factors that go into vulnerability. So it's an understood construct. There are different flavors, but it's not a controversial idea, right? So this is all the counties of Kentucky, and this is social vulnerability from ASTDR, part of the EPA, and they do this obviously for the whole country. But what they don't do it for is inside of counties. And I think, and we learned this lesson too in COVID, that, federal agencies, even state agencies are pretty good at keeping track of counties, but they're not equipped or oriented towards addressing things below the county level. And this is critically important. And we know that health is local, and I argue local and only local. So our data that we have to make these decisions and understand risk, is really missing some important detail. So we turn to, and it's interesting, Heidi opened with hurricanes. We turned to some work that was done in Houston a few years ago, really in response to Hurricane Harvey, which was devastating for Houston and the region. And this isn't the only example of this work, but it's a good one, I think. So they went in and they looked at all the different census tracts in the metro of Houston and looked at the dimensions of risk, of vulnerability that each of these census tracts had. And it's a handy roadmap to follow. So you can see, and I apologize that the data and the graphics are going to get a little overwhelming, but the gist of it is, here you have 3 different communities in Houston on the right side, and a method for adding up all of the different kinds of vulnerabilities that those census tracts have. And it creates a score, which is handy, because it's hard to get your arms around, well, is one thing more important than another, and which thing should I pay attention to? And so while controversial, the idea of getting a score is a great idea. And so that we can say, oh, how do I compare Sunnyside to Galena Park? And I can see that there's an X point difference or whatever it is. And then helpfully also is the visualization, and those are called flower plots on the far right side. And that gives you a more granular view of the different dimensions of risk and their magnitude. So the bigger the flower bloom, the more risk there is. And so, you're looking for things, petals that are exaggerated, and those are going to be specific areas of risk. Okay, environmental risk. And so we've done that for Jefferson County. And I'll just quickly move you through this, and you'll have the slides to look at and send me questions. But this is a roll up visually on a map of Jefferson County of all of the dimensions of vulnerability that the Houston team analyzed. And so I don't think anybody's surprised. We have health equity reports. We have any number of things that look a lot like this map. And so I guess at one level, I'm just comforted that when we look at vulnerability, we see consistent and similar patterns and when we look at other health-related matters in our county. So that's a roll-up. But what that roll-up is made of is all of these different dimensions. Now, I know it's a little bit circular in logic that we'll open with what is the baseline health of the community as we try to understand what the health risk is for the community. It's a little circular, but I hope you'll buy into the notion that when you have environmental exposures, if you already have existing disease, existing illness, you will then exacerbate that, right? So it is an important factor to have the baseline health of the community as a starting point for then layering on risk. But again, it is circular. Some of this has come from past environmental exposure risk, and there's going to be a little bit of that confounding. But it is absolutely true to say somebody who has multiple chronic conditions is going to be more vulnerable when an industrial accident happens, when a flood happens, right? So they're already working at less than full capacity as people, right? And so then we layer onto that environmental exposures. A lot of this comes from the EPA. A lot of it is oriented around air pollution related issues, where there's a solid body of evidence that supports pathways to disease. And then you can get into sources. And of course, if you look at extreme weather events, this was the issue in Houston, right? It's a huge petrochemical corridor. A lot of unbelievable things happened well outside of EPA regulations because it was an emergency. And all federal requirements for monitoring and tracking were suspended during the extreme weather. This happens all the time everywhere, and we should expect it to happen here as well. So there will be just the presence of industry creates, kind of a perennial risk, right? That something could happen at that industry, and it puts the adjacent communities at immediate higher levels of risk, and often unquantifiable risk in terms of the health. I mean, and in most cases in emergency medicine, we don't have a good description of the exposures, and it makes treatment and mitigation very difficult because we don't have the luxury of the long view of what's happened to the person. Obviously, social vulnerabilities, and we're all very familiar with the social determinants of health. I mean, those are clearly factors. It relates directly to the resourcing of these communities when they are actually put in a state of distress. So if they're already under-resourced to keep sort of social function, we should expect that to be significantly worse in the case of a weather event or some other disaster. Community risk, similarly, but different. So looking more heavily at socioeconomics and overall kind of individual and family resource issues, which obviously is important. And then, because this was informed by the Houston work and because we're sitting on a river, we're also keeping flood risk, which as a city, we've dealt with many different episodes of significant water events. And I know that we've got a big flood wall and big pumping stations, and, we hope that that'll be good enough. But we know that, these were designed for a different set of circumstances than we have been experiencing lately. Okay, so that's big buckets of things, how we can look at that across Jefferson County. Then to shift to sort of how we can compute that information and visualize it, we use a piece of software called ToxPy, Toxicological Prioritization Index, which is a tool that is widely used in the environmental health sciences. And you'll see here, all of those components of vulnerability are delineated on the right. And again, we can all debate whether these are the right things or whether there's a different group of things. I'll ask you to suspend that for a moment. These are the things that, we worked with largely to replicate the work in Houston. And so we're trying to be consistent. And then, what we're trying to push this work is modifiable risk, right? So those stars, and again, we can argue about whether we have all the right ones in all the right places, are examples of risks that are modifiable, right? That we may be able to do something about these dimensions of risk and therefore create more resilience in those census tracts. And so it then begins, this goes from being a research analytical project to more of an implementation and action-oriented project. So if I can change the score of a census tract of its vulnerability, that gets us moving in a direction, right? And so that's really what excites us about doing this work as we engage in a broader discussion about the health effects of climate. We want to ground this in some kind of a rigorous framework for action. And so you can see in Louisville, if we take some extremes, right, the California neighborhood and Springhurst, you can see that, and we've sort of shorthanded the big buckets just as colors here. There are many different aspects of vulnerability in the California neighborhood that are at a high level, and obviously many fewer over in Springhurst. Not that there are none, right? And there are risks all across our community, but the profile, the extent is different. And as we look at Springhurst and as we look at California, we can make decisions that are in some way directly, informed by the specific risk profile factors. Now, there you go. So not to just overwhelm you, but, we often think of Louisville sort of, north, east and west, southeast and west. And here we just sort of have these quadrants, and you can see, and these are the census tracts aren't labeled by familiar neighborhood, but just to give you a sense of how much variation there is, and this is a subset of the 190 census tracts we have. But there's a lot of variability, but you can also squint and say, there are some areas where as a community, we could probably get a lot of benefit across a lot of census tracts changing vulnerability. So we don't have to just look at California and Springhurst and say, what will we do there? Or what will we do there? We can look at a constellation of communities and say, well, a bigger investment in local air pollution reduction would create a risk score reduction across 70 census tracts, right? So we can do it in both levels, micro and macro. Here's sort of a what if exercise. So here you can see what we've done is the top is a bunch of census tracts as they currently are in Jefferson County, and as a what if tabletop exercise, we pull out environmental risks, pull out meaning we would modify them to some level that is reasonable to imagine you could do. Some of this is related to, in our own thinking, work we've done in the Green Heart area, reducing ambient air pollution in a neighborhood setting. Here we can see we can change the score, right, before and after, a risk score for these communities. And that ultimately means, as we look at bigger changes, background conditions for Jefferson County, we have made these census tracts less vulnerable. Now, we can't protect them from everything that's going to happen, but as it relates to their health status, we've bought a partial insurance policy to help protect and increase the opportunity for people to be well and survive traumatic events. And then I will sort of close with, this was just released by the Rockefeller Foundation yesterday, on a survey of mayors across the country related to climate and their concerns about it. You can see, and who knows how many mayors were involved in our little green section of paradise there, but these are not unfamiliar things that we talk about all the time. So we are concerned about flooding always. We are concerned about extreme heat always. And we are concerned about air pollution always in Jefferson County. Probably not as much about drought, but so these look familiar. Now, there are also many of the same concerns that there are nationally, but we can see how these environmental factors that were just in this environmental vulnerability work directly connect to the things that people are thinking about, talking about, and are worried about as it relates to climate. And so, I'm not asking anybody to, get involved in a big debate about climate issues in Kentucky. I am hoping that we are all vested in the health and well-being of our communities, and that regardless of the source of these exacerbations, we need to protect the people of our communities. So I find all of this work, and the Rockefeller Foundation has completely shifted their funding focus from the pandemic to climate issues. And so this is all very timely. Heidi asked me to think a little bit about policy implications, just for you all to consider. We are very interested at the Envirome Institute in sort of moving to rational, frameworks, ones that are a little more quantitative for making decisions about resourcing communities. And so to the extent that this is a framework that's useful, that you buy into the idea that we can establish a score and that we can move a score, I think it can move us from sort of analysis paralysis, sort of complaining about the disparities and inequities, and maybe moving to more of an action mindset. So using this kind of framework in the background as we make decisions, not unlike health and all policies, but kind of a little more quantitative feel to it. And then, longer term, really asking ourselves, how much vulnerability is acceptable, and can we begin to prioritize in this community places that we are committed to improving, for generations of divestment or whatever circumstances they're in. Should we be putting up with that forever? And maybe this is an approach to beginning to set some thresholds for what we're willing to put up with and what anybody should put up with. And then longer term, really thinking about these kinds of measures side by side with the usual measures that the Board of Health looks at and that the Health Department looks at. And so we know that we've got a vulnerable population. We know we have an aging population, and there's no reason to imagine that this won't be more important in the future. And then I'll just thank my colleagues. There's no way I did any of this by myself. I probably couldn't do 10% of it by myself. So I got a great team here that has helped with this. This was Dr. Botnager's wonderful inspiration. So he gets a lot of the Walt Disney idea credit. And then we had a lot of hardworking students who pulled these maps together. And big thanks to the Owsley Brown Foundation for funding the effort of these students. And I will take any questions. Thank you.
Okay, thank you. A couple, while the board is contemplating questions, let me open with a couple. The first is, how long, this is by a person who wants everything accomplished 3 weeks ago yesterday, but you know that about me. How long does it take to reduce vulnerability? And I know it depends on what it is, but what's a range?
So there are no published implementation studies, and I don't have at my fingertips any natural experiments that have been done. But what we did in Air Louisville, for example, is we looked at shutting down the coal burning power plants in Cane Run, that whole area in Southwest Louisville, and we saw a reduction in asthma burden in the next 18 months. So there was an immediate statistically significant reduction in events compared to an area that, had nothing change, right? So I really do think it does depend on the specific vulnerability that you're targeting, but some of them can be fast. We believe that the body of evidence on things like air pollution, the effects are immediate. There are chronic effects, but not only the exposure to it, but also the removal of it has immediate effects. And so, I'm actually hopeful that some of those scores could move more quickly than you think.
And is it possible to use the starred items on your list for policy considerations going forward? And if so, let you and I discuss that and come back to the board on that.
Yeah, that would be my great hope. It's sort of the whole reason for doing this is to
Okay.
buy into that idea.
To the board, I'm going to open it up to you momentarily. And I think, and wherever my Chief Justice is, there she is. If the board would like to endorse the short, mid, long-term, the policy considerations as a path to pursue going forward, that would be appreciated. Board, questions, comments?
Hi, Ted. How do we as board members get a copy of this final report?
Final report, like when we're done?
Well, I don't know, whenever you're.
Yeah, well, you can get this report 5 minutes after this meeting.
Okay.
So
Yeah, you're going to get.
it's just my bad.
Are we getting the slides or the?
Slides. There is no report. There is only a presentation. So this
okay.
work is, when I said preliminary, I mean, it is not, we're not done with the work.
Okay, that answers my question. Thank you.
Yep. But happy to get you the finished work when it is finished. But I really do appreciate the feedback as we go. A little bit of course correction is always helpful in this kind of work.
Questions? Do we have examples of how this work is specifically incorporated into neighborhood planning from Deputy Mayor?
We don't have specific examples of how that's been done. It's not to say that it hasn't been done, but not in this kind of more formal, measured approach.
Well, we have great engagement on the part of Metro government, and so going forward, we'll begin to work that in. I think it's important. You called it town-gown relationships, but collaborative partnerships. As I say, it takes a village, but in Louisville, it takes an MSA. And so we need the entire MSA to do this one. Questions?
Well, I've got a comment, suggestion, question. I'm not sure how it all comes together. Hello, Ted. How you doing? One of the I've been involved in a number of health-related policy, big picture kinds of things over the course of a career, and one of the things you discover is that region can be really important. And I think if we consider the region of the country that you're doing this work in, I would think that it would be really critical information for the rest of country, because this is the region where you're going to find probably the least amount of rah-rah from the population about environmental issues and climate change. So I'm just curious as to what kind of proactive steps you're doing to try and make connections with outside folks at the larger level beyond the Commonwealth, who will be very interested in seeing what kinds of things are going on here in this region.
It's a fantastic observation. Thank you, Dean Blakely. So as Heidi mentioned at the top, after the NIEHS outreach, we had a couple of folks get together and had a conversation with the Aspen Institute. And they came into town on a couple of occasions because they were intrigued for exactly those reasons, right? So I mean, all of the big meetings and production domestically are absolutely on the coasts, and the politics of the coasts are different than the politics in the middle of the country. And so, there's a lot of skepticism, what's going on here. And likewise, when they came into town and, we had some community meetings, just preliminary about just this notion, this is the number one issue is climate is a loaded term, and, climate change and all that. And immediately it can shut some people down or get some people overexcited or whatever might happen just by saying the word climate. And this is why we're trying to move this conversation towards environmental. And I know environmental and Kentucky haven't always been good friends either, but health costs, health status has been a huge issue and a widely understood issue in this state. And so if we can start the conversation at health, which is really where it ends too, right? It starts and ends at health. Really we're looking at these other matters as important factors in health. And I know you had Dr. McCants on in your last meeting, who's fantastic. There are a lot of ways to look at our community, our region, and really be concerned about what's going on here that is creating such unhealth. And so, how do we help the conversation move along, diffusing it from, some of the stuff that can, turn people off or get people confused, and really just sort of focus on, do we think that we're the best we can be? Do we think that we're the most resilient we can be? I'm sure the answer is no. And, then if we can meet on that, then let's move forward, because, our population as a state and as a county just is really unhealthy, and the macro trends are not good. And our disparities, after analyzing them for decades, are still profound and getting worse in many cases. So I sort of feel like, well, let's use this. And if the federal government has resources, if national conveners are excited about Louisville and Kentucky, then let's make the most of this without getting distracted by, kind of maybe the worst of it. It's a great point. I don't have a good answer.
I think if you add the econometric overlay, this is a great illustration of an opportunity to raise the flag of the city, the Commonwealth, and the university all at the same time.
That's a great observation. Thanks.
Very good. Next question.
I don't have a question. I have a comment. Thank you so much for this presentation. It was really interesting to see how the risk of vulnerability change with changes in the environment. So it's just going to change little by little and going into policy. Just seeing it, it's really, really interesting. Thank you very much.
Thank you.
Thank you. Comments? Is the board comfortable with our, and where is Natalie? Natalie, can we endorse pursuing policy as it relates to the short, medium, and long term that is in the one slide? Is that appropriate?
You can definitely do that.
Okay. Is the board comfortable with that? And if so, would someone put that forward?
I move that we adopt the short, intermediate, and long-term policies as put forth in this report.
Is there a second?
A second.
Okay, lots of seconds. Is there a discussion? Dr. Eccles?
Should we just put the slide back up?
Yes,
Is that
ma'am.
at all possible?
Yep.
And we will work on adding some content here in terms of what policies will work with the Institute and others to figure out how to do this. And then Deputy Mayor, in terms of how we incorporate it into neighborhood planning, which was a very good lead for partnership. Other questions or comments, or are we ready to vote? All those in favor of approving these environmental health vulnerability recommendations as policy, please raise your hand or say aye.
Aye.
Opposed? Abstentions? Motion carries. Dr. Smith, go back to reducing vulnerability.
All right. Thank
Please.
you all so much.
And we'd like it 3 weeks ago yesterday, okay?
No, I understand.
We appreciate your time and the work of your team. And certainly the thanks for creating the Envirome view and making us a national leader. Appreciate it.
Thank you all. Take care.
Bye. All right, guys. Let's see. The chair does not have any further updates. Mayor Greenberg will be our perspective session speaker in March. Madam Deputy Mayor, a brief update. Anything and everything going on?
Good morning. Well, I can just update to share that we are in the full throes of post-transition administration. And so we've had some really engaging work done in the agencies and specifically within the Department of Public Health this month. Mayor Greenberg went out and was able to meet with several of the public health staff, including Dr. Howard. And so we are really just up and rolling and very excited to be here. Thanks.
Thank you very much. And thank you for your partnership and your engagement. Deeply appreciated. And Deputy Mayor and I have ongoing conversations, and together all of us will certainly change the system, we know. Dr. Howard is in surgery right now, and Taylor Ingram will present the director's report.
Good morning. Just a couple of comments for the board. First, I am very excited to announce that we finally have a fully executed contract for an electronic health record system. I think this has been almost a decade in the making, and it's an important step to enhancing our efficiency, decreasing our reliance on siloed and antiquated systems, and it has the potential to enhance our billing capture. So really looking forward for this to be rolling out over the next couple of months. The other item I'll call out this morning is around our building restoration post-flood. So we're about 2 months out from the initial flooding. And the impacted areas remain closed and under construction. We still do not have a final quote or timeline for when the building will be fully restored, but we are actively working with the contractors on that and in conversation with Deputy Mayor about the long-term goals for the building and how that aligns with the restoration efforts. In your report, you'll also see some brief updates on our initial meetings with the new administration and an update on flu season, but there's nothing significant to share on either of those.
Thank you so much, and thank you for your ongoing engagement with us, and deeply appreciate, at least Madam, as a matter of personal privilege, all of the wealth of information you are able to provide. Let's see. Now let's move to our partners here. And I've asked each, not for what you did over the last 30 days, but any key issues about your group that impacts public health or the Board of Health. So first, Family Health Centers, Dr. Irwin.
Right, I'm happy to announce that Family Health Centers has entered into a lease agreement for a storefront on Taylor Boulevard in the Hazelwood Shopping Center. It's been
Yay.
a long time coming. We will renovate the building and install a pharmacy and a small immediate care center for our patients. And pharmacies are important to community health centers because that's one way we can generate revenue to help offset the costs we incur by providing services that don't generate revenue. So that's an important thing. Also like to
It's
mention
also
that
an important thing in terms of people's health and whole health, if you will.
certainly it will provide, the pharmacy will provide access to medications more readily. In that particular area, 40214 is a zip code where a lot of our patients come from. It's in fact, the residences of most numerous group of patients come from, often refugees or immigrants. So having that culturally friendly pharmacy, I think, will be a big benefit. And as you know, Walgreens in that area closed down recently. I think that's all I have to report. Any questions?
Thank you. Let's move to Dr. Stone and the Jefferson County Public School System. And I had sent her a note. I'm most interested, given the Parenting in America, and I think the board is, to hear mental health status within the schools and how the school system, which has proved through COVID that it is a center for access to families in Jefferson County. So, and hats off to your team for nurses in every school and et cetera, et cetera. Floor is yours.
Yeah. Okay, so I will start just to give you an update on the measles, since we've got grave concerns with the measles outbreak in this city because of the outbreak that has been in Columbus. So the state health department has been working with us along with the CDC to help prevent an outbreak. Just so everybody knows, we've got almost 12,000 students in JCPS who show as not being current on their measles vaccinations. And this is been a longstanding problem. The Board of Health has been trying to help us address, but we're not making any forward progress on increasing access to vaccinations for students, which are primarily kids living in poverty and children of color. We're having some in-school vaccination clinics this Saturday on February the 4th. We'll be having a community vaccination clinic at ESL Newcomer Academy from 9 o'clock until 2 o'clock. And we'll be giving MMR vaccines, COVID vaccines, and flu vaccines. They'll be available for students, staff, and there'll be some vaccines available for family members as well. The state health department has been phenomenal. Your health department, Stephanie, has helped get some flu vaccines so we can vaccinate kids who have private insurance that need a flu vaccine. And then Norton has committed to vaccinating kids that have private insurance if they are only receiving a flu vaccine. So they will do that. As far as mental health, we have a long road ahead still on vaccinations, but work is happening in that area. As far as mental health in the schools, obviously the pandemic has had a significant impact on everything. And the one good thing that has come, two good things have come related to the school district. One is it showed us where significant disparities exist. And we have better tools now. We've implemented an electronic health record, and that has been a game changer to help us identify and work to address disparities. Right now, we have about 2,000 students that we know have a mental health condition, I can tell you that is vastly underreported because it's not been something that historically has been collected and reported in our student data system. So what school nurses are working on related to mental health is improving the documentation, making sure that we are aware when students have mental health conditions. We've done suicide prevention training with school nurses. That training was, first of all, for self-wellness and prevention of suicide in nurses, which has increased significantly since the pandemic, but also to recognize signs of suicide in students. So we that continuing education has been offered, and then we're working to have mental health first aid for all school nurses. And so we've got about 170 school nurses right now and 50 certified nursing assistants, which is so significant and helpful in helping to address these needs in our students. And that's from a nursing perspective. There's also lots of work in the district. There's been implementation of screening of all students for mental health concerns. Of course, the school district has mental health practitioners now in most of our schools, not all of our schools, because those positions have not always been easy to fill. But there are positions available for all the schools. And then, of course, the work that our school counselors doing. We have behavior specialists, lots of people within the district. There's also been a grant that the district has gotten where we'll be increasing now I've lost the name, but it is, we're going to expand the number of schools that really do some intensive intervention with students. Oh, it'll hit me as soon as I quit talking. And the restorative justice. Sorry, the district has, so we'll increase the number of restorative justice schools that we have, and then increase supports for community health workers that can work with families of students that are having some issues related to behavioral health in the schools. And glad to answer any questions that you may have.
And in response, Nicole had a note in the chat box about, do we have vaccination broken down by zip code? And my recollection there is that they follow the COVID vaccination.
Yes,
I think,
absolutely.
Eva, because they're not separate, we don't have a way to track that other than in the new EHR that the system is using. But it pretty much, in fact, the chair here has used that. And those zips are in the area that you're most familiar with. So it's in West End, Shively, Algonquin, the immigrant area, 40219. I'm doing this from memory, which is never a good thing, but you would not be surprised. Pleasure Ridge Park.
Yeah, and we did pull it separately for measles, mumps, rubella, and in South Louisville as well. There are several areas that were where a lot of kids aren't vaccinated. We've met with yesterday. I met with a group who's going to help us really try and work more with our international community. We're applying for some grant funds to help us do that as well, because we really want to increase trust and work together, get in the community so we can develop those relationships, because you know there's just a lot of distrust. And I said restorative justice, it's restorative practices. And I see that you've asked specifically which schools, and Dr. Eccles, they had not determined those schools yet, but I know that they're in the process of determining which schools that will be expanded to.
And we'll do follow-up, Eva, I'll do follow-up with you.
Okay,
on this.
excellent.
Yeah. Good. Excellent
One quick
report.
question.
Dr. Eccles?
Yeah, sorry. One quick question, Dr. Stone. I just wanted to clarify. I know you said that we have 12,000 documented or known children that are not vaccinated, or we don't know if they're vaccinated for MMR. And I know that you guys have been doing such amazing work with really trying to make vaccines accessible to the students and their families. And I seriously have to commend that. It's been amazing. I just wanted to know, right now, is our issue bigger with um, engagement or access? So if we have students that are wanting an MMR vaccine, are they able to get it regardless of their location? Like, do we have the vaccines available for them, like at the school, or is it more like, is the issue that we're not able to engage them to get them to get these vaccines, or are we also having trouble getting them to a location or, clinic where they can get the vaccines?
So, my response to your question is going to be both. One is that even prior to the pandemic, I mean, when I started here in January of 2018, we had 1 in 5 kids that was not current on their vaccinations. And if you look at the city of Louisville, right now, we only have 64 providers in the city who are registered to participate in the Vaccines for Children program, which is the program that provides vaccinations to children without health insurance or children who have Medicaid. And so we, as the capacity, not all, very evidently, many providers don't participate in that program. I'll just say it that way. So if I had Passport, for example, and I was assigned to a healthcare provider that didn't participate in the Vaccines for Children program, then I would go to that office and maybe could have a preventive health exam, but our data suggests that that's not happening on a regular basis either. And then I would be told I needed to go someplace else to get my vaccines. Well, the only other option for them to go to is to the health department clinics, which are phenomenal clinics, but the health department doesn't have the capacity to vaccinate all of those children either. And so that's what has prompted us. I mean, we're the public school district. This vaccine issue is a community issue. And but we're trying to help pick up and mitigate some of that. But what COVID certainly taught us is that there are significant trust issues as well. And so we're going to work on figuring out how we can mitigate those within the district, but we've got to do that as a community also. We have great systems in place. We have great clinics in place, but we have 4,000 more children who are immigrant refugee kids this school year than we had last year. The influx is so great right now that we have Newcomer Academy can't take any more students. Students now are having middle school and high school students now until next school year are having to go out into the schools directly rather than to Newcomer Academy. And so that's just going to compound our issue because most of these kids aren't coming into the country with their immunization certificates. So we have to do more to be able to address the needs with our international community who are not all routing through the clinics that are already in place, if that makes sense. They're not all going through Kentucky Refugee Ministries or Catholic Charities. And so they're coming to school, though. And so we collectively need to be able to address that on a systemic level.
So, Dr. Stone and the group, thank you, Dr. Irwin, for the comment in the chat box that Family Health Centers does provide VFK. I'm trying to get all the
VFC, Vaccines for Children.
Yeah,
yes.
Vaccines for Children. I'm trying to get it right. There is an issue that Dr. Batista Severa had mentioned to me early on, and I'm very cognizant of it, and that is the cost of vaccines and vaccinations and who pays and who doesn't pay. And so there's some town and gown relationships that I am going to follow up on because our major healthcare system here, which is not Craig's and mine, or Dean Blakely's and mine, doesn't offer it, so, or doesn't pay for it. So getting the serum is an issue. And I believe Dr. Stone mentioned she was trying to get foundation funding for it, which is a good avenue. But we should have town and gown relationships when there's an urgent need, especially in under-resourced areas. We're not talking about the East End. So anyway, more work to be done in this particular area. But it is good that the system, and if you think about the public health system throughout the last 3 years or more, has really become the hub for healthcare as it affects under-resourced populations as a whole, because of the hub system, and people drop their children off, they pick them up, they get food, etc. And if you can mix that, that is a good thing. Deputy Mayor had a question in the chat box in terms of, and I think Dr. Stone I had asked, is there any incentive built into GLMS? And I didn't see anyone represented here today, but I think going back to Dr. Mona Lisa Taylor, who is now the chair of KMA, I believe, to see if what we can do to get the physician community, JLMS and others, more actively engaged here. But I think some sort of incentives, and I don't know what those are, because I think what the issue is, they're not paid for the administration of the vaccine or the payment of the vaccine. And so it's always a cost issue. So
Well, they're paid, but it doesn't, for most cases, meet
cover
cost.
it.
It's
Yes, I get that.
$4 roughly per.
I'm sorry,
That's what
how much?
Medicaid pays. Medicaid pays roughly $4 for the VFC program. If they're uninsured, then no, there is no, the vaccine's provided free, but not the administration of it. But it is, if we get a case of measles that is so, measles is so contagious that if we get a case in the city, it's going to impact everybody, insured, uninsured, international community. It's a huge issue that, just as Dr. Smith was talking about, these areas of increased vulnerability impact us all. And so there's just, to me, a moral imperative here to wrap our arms around the people that we're welcoming into this city and to help ensure that everybody has access.
Thank you. Any other questions for Dr. Stone, who has more than a plate full? Do we have a map of vaccine needs aligned with providers not participating in VFC? Do you have a list of, but it would be.
I can share that with you.
Okay. Would you get it to me as well, and we'll get that out to folks? Absolutely. Thank you. Other questions for Dr. Stone? GMS is not here. Kentucky Nurses Association?
Yes, good morning. The nursing shortage affects everyone in the city as well as in the state. And we have a major nursing shortage, and we are working on that. We're doing our Nurses Day at the Capitol to talk with legislators about addressing the nursing shortage, decriminalization of nurses, as well as workplace violence, which impacts whether nurses stay in the profession or whether they leave, which impacts the nursing shortage. We are gearing up to appreciate and support nurses for Nurses Month, which is in May. We are also in collaboration with the family health centers. They want to provide vaccines in the city. And we've applied for a grant through the Kentucky Department of Public Health to do 20 vaccine clinics. And we think we will get that. And we're ready to go. We're ready to go.
Excellent. Excellent. Thank you.
So that's about all I have to report for the Kentucky Nurses Association.
Well, we depend and give our support to the true champions of healthcare, our nurses. That's for certain. let's see, Ms. Somerville, GLI.
Good morning. I'll be quick. I just have a short update. We released our local legislative agenda last week at our Capital Connection event with Mayor Greenberg. I'm going to put it here in the chat if for those who haven't seen it yet. There are a couple sections that might be of interest to the group. Homelessness and housing. There is a short public health section. We aren't working on any specific ordinances at the local level at this time, but over the next couple months, if anything that would be of interest to this group comes up, I'll be sure to let you all know. But we're very excited to work with the new administration and the new members of Metro Council. So just looking forward to that.
Excellent. Thank you for sharing that. Dr. Eccles, Dr. Bautista Cervera, any priority that you need public health, the board's work on?
Today, we had our meeting and we're establishing connections and developing partnerships, working with Jefferson County Public Schools, Family Health Centers, Louisville Metro, trying to find the best way to increase the vaccination rate in our community.
Perfect. Is there any new business or areas we have not covered that we need to cover?
Heidi, just briefly for the Outreach and Coverage Coalition meeting.
Yes, ma'am.
Our next meeting is scheduled for February 13th at 4 o'clock. We will be discussing outreach strategies for the Medicaid continuous coverage unwinding. The state is estimating that approximately 47,000 Louisvillians are at risk of losing their Medicaid coverage during this unwinding. So we will be discussing strategies to make sure that those folks can enroll in other affordable health insurance.
Excellent. And I shall be on that call, pending no wobblers. And just a shout out to the work that Ms. Shoemaker does. It's a tremendous coalition of the groups who are engaged in Medicaid, brings all organizations together to speak with one voice, and appreciate all the work that goes into it. Okay, anything else? Any other announcements? Comments? I'm always looking for topics that you think we should cover, so please send cards and letters. All right, March 1 is our next meeting, 8 a.m. virtual. Mayor Greenberg will be our perspective session speaker. And with that, the chair will entertain a motion to adjourn. Hello?
Adjourn.
Is there a second?
Second.
Any objections? This meeting stands adjourned. I will see everyone online. Keep the cards and letters coming, and please stay safe and be well. I appreciate everybody's engagement this morning. Take care.
Thank you.